Fetal alcohol spectrum disorder is a significant public health and social issue in Nova Scotia.
I began my journey into advocating around FASD when some of my children that came to me as a foster parent began to exhibit behaviors that weren't, that really were not solved by using the existing ways of working.
Fetal alcohol spectrum disorder, or FASD for short, is a permanent organic brain disorder that can affect an individual whose mother drank while pregnant.
FASD is really one of many harms that result from the use of alcohol, but I think it's especially important because of the long-lasting nature of those harms.
It's not only about alcohol, right? It's about the determinants of health, and that's what we've really come to learn.
In my more than 20 years in special education, I have dealt with fetal alcohol spectrum disorder many times without knowing it. And I really wish I had been more informed in those years in the way I would have developed intervention or better understood the needs of the individuals affected with FASD.
The difficulties for families living with FASD cannot be overestimated, and actions to support them should be comprehensive and timely.
Children with FASD are not being recognized because many clinicians simply don't have the knowledge or the training or the experience to identify it. A lot of children with FASD can be mistaken as having something else, for example, as having ADHD or having bipolar disorder or oppositional defiant disorder, conduct disorder. It really makes them hard to parent and to teach. They very often have poor impulse control, they show poor judgment, they have trouble learning from the consequences of their actions, which makes them prone to making the same mistakes again and again and again.
So a mother with FASD may have difficulty scheduling things, remembering things like to take your purse when you go out to shop, to remember to turn things off like the stove, to remember appointments, to make good decisions about the day-to-day care of a child, to make good decisions about shopping, about how much money to spend.
As adults, they're really prone to mental illness, such as depression, anxiety, substance abuse, psychosis, personality disturbances. They are very often unable to live independently. They're unable to hold down a job and maintain relationships. And a large proportion of adolescents and adults end up in trouble with the law and end up incarcerated.
One of my children went through 7 different incarcerations, in fact, ended up in Dorchester before something was done, before something was really done. That makes me very sad and very angry.
Nova Scotian women are drinking more alcohol and drinking more heavily. FASD prevention is complex, and there are many factors contributing to why pregnant women may drink, such as poverty, past trauma, and family violence. Prevention efforts must address these root causes.
Women come to us that are struggling with their own abuse, violence in the home, their own horrific pasts, and they're using alcohol as their own medication and a way of coping.
Part of feeding into that is how the alcohol industry is actually very explicitly and deliberately targeting young women in their advertising and also in the types of products.
In the past, it was often you prevent FAS by thinking about babies. And actually, it's women who have to change in order to be able to prevent FAS, right? So we pulled the lens around the mother-child unit. And that was the first thing that everybody thought was really interesting, because the people from child welfare were really thinking about it from the children's side, and the people from, maternal health were really thinking it from the women's side. And so having those really complicated discussions about how do we do this well together so that the best outcome happens for both women and children.
In the province of Nova Scotia, individuals and groups of people from different sectors are concerned and active in addressing FASD.
I think that we need to look at the way we put policy together in this province. We need to think about changing the way that we put services together and the models that we're using, because for my families and my children, those in the office professional visits were not working. What works for them is a safe, nurturing environment that's based in the community, that's a drop-in service, because they'll access it when they need it. We need to begin to educate the people that are at the entry level of women that are pregnant and possibly using alcohol or drugs during that time. We have to train them to understand the broad impacts on women and women's lives, women's health.
As a member of the Intergovernmental Exchange Group, I think it's crucial that we send a message that across all the silos that we typically work in, we have this amazing structure that works together in better understanding both the prevention aspects and the intervention aspects of fetal alcohol spectrum disorder.
There needs to be a shared understanding that inappropriate alcohol use crosses all social systems, and the impacts of that use are a community concern and the responsibility of all of Nova Scotia.
We need to be able to have the discussions, and people need to be able to work through these ideas that are not altogether familiar necessarily within each of their disciplines. And it's the bringing people together and to really taking the time to make sure that we've built this net of support, because then it's not a lot about new funding.
The most important are population level or broad community level approaches that really deal with how alcohol is priced, how it's sold, and how it's marketed. And we need to understand those factors, and are we prepared to do things differently than we're doing today?
I worry that we're going to move forward with programs and with supports without listening to the women, without hearing their voices, and the voices that are telling us what isn't working for them, and that we'll not listen and continue to create the same situations as we have. I'm worried that we're going to put pressure on women, and women will go underground and they won't come to our programs anymore. And I worry that we are going to push for diagnosis before the services are available to all the individuals that are affected by FASD.
I think it's important to recognize that this is a permanent, organic, lifelong disability that requires very thorough and thoughtful diagnostic processes and very thorough and thoughtful intervention strategies.
We need to start thinking not only about quickly finding out if she's using alcohol in pregnancy, but actually building a relationship that is a trauma-informed one. And I feel like governments really need to hear that those things don't go quite as fast as, just find out if she's drinking.
If we had real interdepartmental collaboration and collaboration with those that are working in the field, on the ground, or in the muck of it, we would have women coming forward, wanting to talk about what's happening with them, wanting the support. We would be out there in the schools educating young women about alcohol and the effects of alcohol on fetuses when they were 12 years old. We would have in the community the understanding of what the impacts of alcohol can be, and for people to be making the right choices in their life around the use of alcohol during pregnancy.